Welcome to another in our video series on the topic of microsocial determinants of health. I'm Doug Nussman, head of sales for Montoux in North America. And with me today is Mike Hughes, subject matter expert. And in this session, we're going to talk about the opportunities that long-term care insurance providers have to manage their claim costs by managing social determinant related risk. So Mike, quick question. What roles and opportunities do you see long-term care insurance providers having in this space?
Quick question, maybe long answer. Let's see. Well, look, I don't think it's a secret that the long-term care insurance industry is facing a specter of future claims activity as their insureds age into the need for outside care, 70s, 80s, 90s. And I also think the industry knows that far too many claims start with nursing care. I think it's about a third of overall claims. And we all know that nursing care is on average about twice as expensive as home care. So pre-claim readiness programs and on-claim programs to both identify folks that may be at risk of going on claim or moving from home care to nursing care, and then intervention programs to reduce those associated risks make a lot of sense.
That's great. So what do long-term care insurance providers need to make this happen?
Well, I'd say the very first thing any long-term care insurer has to do is to examine the books of business using the amazing claims propensity models that Montoux brings to the table. I'm making a shameless plug for you here, Doug. So, no, seriously, once you start to risk tier the base, engaging insureds and learning more about their microsocial determinants can be very, very effective to inform the level of continued pre-claim engagement that you need to do. And I'd say that this engagement would primarily be around things like readiness or lifestyle management programs. Basically content and services that allows you and the insured to find out more about their readiness to age at home and maybe identifies associated risks. But these sorts of programs would be delivered in a way that would not just benefit that insured, but also their family care, potential family caregivers as well. And I'm aware that for some insurers, this may be a challenge if they haven't really been in the practice of regularly communicating with their insureds. But I'd say that's entirely within the brand promise of a long-term care insurance policy to provide the resources to support safe aging at home and to plan an age at home, the place that most of us want to be. We talked before about having financial resources in a plan. So the existing policy already provides those financial resources at time of need. But again, that only takes you part of the way. Resources that can help get people smart about the best ways to age at home really do complete the picture and the promise of any long-term care insurance policy.
All right. So with that said, where do the social determinants of health play into all of this?
Well, I think that any pre-claim intervention program can, ask the questions that can kind of fill in and paint the picture of microsocial determinant risk. But let's think about somebody who's actually on claim. And the reason that they're on claim is that their ability to do day-to-day tasks has declined to the point of needing help. And if that help is not well organized or delivered, then fall and injury risk goes up and the likelihood of a nursing home claim increases. So the quality of care, the care plan, really must examine the microsocial determinant risk and take action to remove them. The microsocial determinants that drive, 70% of all health outcomes, right? And this means, home modifications, looking at home safety risks, pick up all the clutter, bringing in proper assistive devices, educating caregivers and giving them opportunity for respite, making sure that care is, looking at the whole picture of care over the week and looking at times when risk is highest and making sure somebody is there live and in person during those higher risk times if you can't afford 24/7 care or if you don't need 24/7 care. And really making sure that somebody is properly managing their chronic conditions. They got a list of meds, they know how to take them, they're monitoring vital signs, all of those things. And here's the thing, if the long-term care insurance industry can demonstrate that they can meaningfully reduce risk through programs that reduce risk around these microsocial determinants of health, and if they can do it in a way that's efficient and scalable, then there's not just a tremendous opportunity for ROI. There's also a tremendous opportunity for leadership.
So, well, what do you actually mean by that?
Well, the long-term care insurance industry has some pretty unique characteristics that put them in a position to pioneer work in the social determinant space, microsocial determinants in particular. So I mean, a huge proportion of nursing home risk relates to social determinants of health. It's all about rates of decline and how this is supported, and especially by family caregivers. And to look more finitely at this risk, the industry can't necessarily model it around medical data like health insurers can. It can arguably get to the social determinant data more easily, and this data is, I think, more effective at predicting that risk. You also have an industry with a lot of closed books. Providers aren't competing with each other anymore, or many providers aren't competing with each other anymore. And I think they have the incentives to pilot and trade best practices and experience between each other to collectively generate better ROI. And really, I think when we're talking about the industry's opportunity for leadership, we're talking about blazing a path for the clinical world. So I think health insurers, health systems, and long-term care insurance providers have very similar goals. They want to reduce risks that put people into institutional care. And many of the same factors that influence hospitalization also influence the likelihood of needing nursing home care. Now, the clinical world is looking at this, but they're looking at it through a clinical lens. They're looking at clinical care coordination and so on, and they'll eventually get to examining microsocial determinants and further reducing risk and getting more return, through those programs. But the collective lessons that the long-term care insurance industry can generate now through those types of pilot programs can be shared or even sold through to clinical providers and insurers as they're ready to pick them up. And that really means that the long-term care insurance industry can be a force for positive change in the longevity space at a time where more and more Americans are aging past 65.
Thanks, Mike. That was really good. And I appreciate you sharing your thoughts with us. To continue the conversation, please feel free to reach out to me or Mike directly.